Hello and welcome to the ECAPS Watch podcast. I'm your host, Kevin Houlihan, CEO at Workflow Services. Today, I'm super excited to be joined by Dr. Emily Zadvorny. She serves as the CEO of the Colorado Pharmacist Society. Dr. Zadvorny also is a clinical associate professor at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Services. Dr. Zadvorny is known for her work in legislative and regulatory process and has been instrumental in helping to influence public policies and pass several key pieces of legislation to expand pharmacists' scope of practice and payment for services. And maybe most importantly, she's a pharmacist and has a long background in practicing in ambulatory care. Welcome today. Super excited to have a conversation. Welcome to our podcast.
Thanks, Kevin. Great to be here.
Yeah. So can you start by telling me about your role at the Colorado Pharmacist Society and some of the legislation you've worked on and the changing role of the pharmacist's ability to deliver care in Colorado?
Absolutely. Happy to. So, as you mentioned, I'm a pharmacist for more years than I'd like to think, but my practice goes way back and always saw the value of pharmacists, right? Providing patient care. Much of where I practiced was in direct patient care in a clinic-based environment, but always realized the potential we have with our communities and providing services to our communities. So when I left direct patient care and took this role on, I really wanted to focus on that as a bigger picture item. So I am the CEO for the Colorado Pharmacist Society. And obviously that is a big job with a lot of things running a state association, but my passion lies in the advocacy world. And over the years, we have really focused as a state association on optimizing the scope we have on the books so that we can provide the services that we're trained and educated to do, right? So really practicing at the top of our education and training. So a lot of our work over the past 8 years or so has been optimizing that scope and getting a very broad scope of authority to practice in Colorado, one of the broadest in the country. And then secondly, which I think has to be right alongside that, is advocacy around payment for services. Because as all of your listeners probably know, we're at a real crossroads with, the positions of still just providing our dispensing services, but really, what are we going to do 5, 10, 20 years down the road? And how do we make that a sustainable business model in any setting, whether that's in a community-based pharmacy, whether that's in an ambulatory clinic. So we started also working on public policy through our legislature to get payment for clinical services, regardless of setting in Colorado. So we've had luck over the past 10 years of passing both Medicaid-based provider status or payment for services and commercial-based payment for services. And it was a multi-step process, not an easy one. There's always compromise, but at this time in Colorado, we do have on the books payment for both of those populations. So both the private payers and the Medicaid population.
Yeah, I would say, Colorado serves as a model in comparison to most of the other states in the country. You guys are doing some amazing things and have a great success. And our podcast here is really focused on this, ECAPS federal legislation. But can you talk about anything you've learned in the process over the past several years and what has led to your success, or what are some of the challenges, or anything that you've found to really help make things more successful and be positive in the journey?
Yeah. Well, I think we all know too, right? Like, what's happening in states like ours is that because ECAPS hasn't passed, or a version of ECAPS hasn't passed, there are certain populations that are actually at an inequitable position. So meaning like states like ours that have been able to get other payment on the books, we have to turn away payment. We have to turn away the ability to have those services paid by, the Medicare population. And as you and I have talked, and all of us know, the way Medicare goes, the way private goes. So even though we've gotten private payer on the books, it's not going that easily. It's not implementable like it would be if we had a national provider status. But I will say, we did not have a ton of pushback with our payment bills. And I think that's because on a smaller scale, I don't think the debate really exists as far as payment parity. I mean, it's
Yeah.
not as easy as just getting it passed, but at the same time, we did not have pushback from other providers on the payment. In fact, we had the chief medical officer of one of our safety net hospitals and clinic systems testify in support of our Medicaid
Mm,
provider status bill. And a lot of that comes from, the bigger picture of access to services, employing pharmacists in clinics and associated pharmacies. That's a good model for everyone if pharmacists are eligible as a revenue source as well. So I think the successes were, not as difficult as we might have thought, at least on the payment side.
yeah.
There's always, some debate on scope and turfs, which I know ECAPS doesn't get to, but that's still come back into the fray, even on ECAPS, is what's the scope. And really we have to focus all of our conversations back to this is about payment, not about scope.
Yeah. And so can you share a little bit, what was the core sentiment of that chief medical officer's testimony? Was it just a recognition that access to services is good for everybody and isn't a detriment?
100%. And
Yeah.
also the value of pharmacist care is, I think, very well established. I think that that's more obvious in a clinic-based environment, which
Mm,
our laws also help, right? So,
mhm.
and I guess I want to stress that point. Our laws on the books, are providing payment for pharmacist services in a variety of settings. So in a clinic-based environment, here is a pharmacist who's been doing chronic disease management or acute services for free, right? And that health system has to figure out how to afford that
Right.
pharmacist. Now they're providing those same services that everyone really loves, but they can actually generate some revenue. And that goes back to supporting their salary and supporting FTE and even gaining FTE. So that's exciting on that side. And then, of course, on the other side of community-based pharmacists, just generating revenue to keep the doors open and provide those valuable services. But to get back to your other question, yes, that was recognizing the value of the services that were provided and add to the bottom line of the clinic helps everybody, right?
Yeah.
So
And so one of the things that I think is important there is we're not talking about controversial services, right? These are like key things, preventative, readily available urgent care type services. This is not things that are questionable in terms of should anyone really be doing this. And so just access to patients, I think, benefits everyone across the healthcare continuum. That's an interesting thing for me. And you said something that's can seem crazy to folks who might be in a different state or might not be tracking it as closely. We're not even talking about the pharmacists in Colorado being able to do anything differently. We're just talking about them being able to do what they can do today for everybody that comes in the door instead of only for a subset, right?
exactly. And for that to be covered by a patient's insurance instead of
Right,
cash. And we're shocked at how many patients are actually willing to just pay cash, but that's not the right way to go, right? If you
right.
have health insurance and that health insurance would pay someone else to provide that service,
Yeah,
then it should rightfully be paid to the pharmacist as a provider as well. And that's that whole parity discussion. And I think I love the way ECAPS is set up because it is set up for parity of payment. It's not set up to be at a discounted rate and provide those same services that another provider would do. But you're right, it's acute services that are, we call it a doorway and a destination. So
yeah,
we're not trying to take business or shift from other providers. But in those cases where those other providers are not available, not accessible in a rural community or somewhere, that we are another point of access. And if that point of access works, then we get paid to do that same service.
yeah. You mentioned that the ECAPS bill has a scope written, defined in it, and that is it's not everything. It's not everything that pharmacists in Colorado can currently do, but it is a bunch of stuff. In my perspective is, let's not let the perfect be the enemy of the
Yeah.
good, and there's a huge opportunity to like take steps forward rather than jump off a cliff and just be so far ahead. My view is that it is a key first step, and with the passage of ECAPS and the expansion for Medicare, there will be more stuff that follows. And you talked a little bit about that. As goes Medicare, so goes commercial. Have you seen examples of expanding the scope a little bit and realizing the value of that, and then that providing evidence and support to expand even farther?
Yeah, in fact, our own Medicaid department is a great example of that. Um, And I agree with you. It's cracking that door open and getting in Part B in the Social Security Act, and then hopefully, what's already recognized, which is the value of our services, will be expanded. But our own Medicaid department was a perfect example. When we passed House Bill 21-1275, we had to go through the fiscal note process, and like a lot of states, at first the state goes, oh, if we pass this bill tomorrow, all 5,000 pharmacists in the state of Colorado will start billing high-level codes, and this will cost, ours was a $10 million fiscal note. Well, that didn't fly. So we had to narrow our provider status bill to only cover things under a collaborative agreement or a statewide protocol. Still is very broad. We have a lot of statewide protocols that allow the, hormonal contraception and smoking cessation and things like that. But what happened in the back end, which is really great, is that Medicaid decided on their own to expand coverage for other things we were allowed to do in our scope. So the way I would love to see that is the same with ECAPS, right? So yes, this is what the bill says, but just by allowing that payment mechanism, then it's not like payers can't pay for more than you mandate, right?
Yeah,
they can
right.
choose to pay.
Right.
And that's what our Medicaid department has done, is they've said, well, but you have all these other practice authorities, test and treat, chronic disease management. Those are all within your scope of practice, and we will pay those as well. So I hope that that's the way it'll go, and that once the dam is cracked, or however you want to use an analogy, that truly the healthcare system will see that value and pay for those services, not because you mandate it, but because it's actually increased to access, makes things available, and better care for patients. And another funny thing that happened with passing our bill was, at first, there was this kind of, should we do this or not? At the same time, our state Medicaid was putting out a call for providers. They're like, we're short of providers. We need providers. And I said, here's our bill. We're trying to be providers for you. And I think it's just still that age-old thing of not thinking a pharmacist as a medical provider.
Yeah.
And I think that's starting to change, just wearing those two separate hats.
Did you ever see a case of someone having a light bulb moment of realizing, oh my gosh, there is a pool of providers that are close and open and available and capable and eager that could help solve this problem, and they didn't realize that before? Was there ever a case where someone came to that realization that you can remember in the process?
I don't know if I have a set moment, but it happens more and more all the time, Kevin. Like literally, I'm not in very many, meetings, and we have great relationships with a lot of provider groups and public health and other, patient advocacy groups. It just gets talked about more and more of like, yeah, I mean, this is amazing. And there's a whole, trained and educated workforce out there. It's come up a lot lately, especially with the Rural Health Transformation Program grant funding. Everybody's talking about the value of the pharmacist. So I do think it's happening, not so much a light bulb moment, but I just see that momentum really building and changing.
Yeah. So one of the things that we're super passionate about at Workflow Services, and you touched on this a little bit, with the concern of, oh my gosh, all of a sudden these pharmacies are going to start billing these high complexity codes, is it is a little bit different, right? It's the ECAPS brings the opportunity to serve the community better, but it also brings the requirement that you're thinking about this like a clinical service and billing medical claims. Do you have any advice for folks out there? Folks in Colorado can do this today. Folks in a lot of states can already do that even prior to the bill passing. Any advice on how to think about that today?
Yeah, I mean, it's still a barrier, I guess, for lack of a better word, of especially in the community-based environment, of how do I get from A to Z, right? Like, I'm so used to billing drugs over here, but I can do these services, and how do I do it? And so technology companies like you guys have been hugely helpful, but I think it's still, like that they have to build this into their business model, and they have to figure out how they'll afford it, and B, will it be worth the ROI on it? And then C, like, what services does my community need? So there's a lot of this like up and going. And it's interesting with ECAPS because it is all about the respiratory conditions and things. And I see that in our state. I see a lot of test and treat services going on, whether that's cash or billing right now. But at the same time, like, they have to figure out, is that what my community needs? So again, I think standing people up with the mentality of how do I start to, change my practice, change my business model, get these services as part of what we offer. And it's tough. So I think we're seeing that happening. We're also seeing like, okay, if we could get better reimbursement on the drugs, we could have more time to do these things. So we're at this position where it's hard for people to implement, but they want to. And I think it's just support and infrastructure that makes it easy, because we weren't trained in this. Like I as a pharmacist, we didn't even really get business training. We didn't get, coding training. We didn't get any of this type of training. So it's sometimes an uphill, and support helps a lot for that process.
Yeah. And one of the things that we've seen is there's so many pharmacists in Colorado and across the country that are successful with it today. And so it's one of those things where you can do it for sure. And it's also one of those things where the hardest part sometimes is just getting started. And we hear that from pharmacies all over the place. Once I get, I was afraid to get started. Once I get started, I actually totally can handle this. And they realize how capable they are. So that's an exciting
connecting
thing.
People to share, right?
Yeah,
so like,
right.
and you guys can help. I mean, I think if we are connecting people and saying, look at, this is how you do it. You don't have to start the wheel, you don't have to reinvent the wheel or start from scratch. Like, let's look at these pharmacies that are successful. They are doing it, and then share those practices widely. I think that'll help us kind of get that momentum going.
Yeah. You mentioned that it really is important to focus on the kinds of services that can benefit your particular community, wherever your pharmacy is. And you've done a bunch of work in expanding the scope of pharmacists in areas where there are provider shortages. I would love to hear if you have a story around how you've seen that impact a community or a patient or a pharmacy, any like great success stories that are coming out of that?
Yeah. Oh man, I'll tell you what, and me, even as a patient, I would appreciate this. I mean, so we have a rural, provider, a rural community pharmacy, but down in southeastern Colorado. He's had a really successful time of doing test and treat, so what ECAPS would cover. And the physicians are so happy, because what happens is, it's a tiny little town. They're not even there most of the time, but they also want to close on time. So talk about like what can happen, right? So they are just pleased as punch to be able to say, hey, we close at 4, but then they'll send patients, what happens is after hours or on the weekends. So this pharmacist has really had luck with treating patients to help that physician group also kind of almost, turf their not turf, that sounds negative, but be able to help that workload with patients. And so they've had a really successful model of doing the test and treat for flu and strep down there, of, especially filling that niche of the pharmacy is still open until 6 or 7. So, we have to close, we're out of appointments, but you can have this alternative model. So that's been amazing. And then so many instances, even in the not so much rural, but even here in the Denver metro area, of I've referred patients, I've referred colleagues, friends to pharmacies for acute treatment of things, right? They're like, oh my gosh, I think I have strep. I'm like, go to the pharmacy right now. And I send them over there. They get in, they get out, and they get treated within 45 minutes. I mean, how can you do that? And a lot of them are on a weekend. Or, we can do UTI treatment, right? So like, that is not something you want to wait 3 days for. So being able to say, hey, go over to this pharmacy. I know they do this service. And again, evaluation and test treat done out the door. So it's like, when it works so magically, and patients are so happy, versus where do I go? How do I find a physician? Or I go to urgent care, I go to the emergency room. Then they send a prescription somewhere. I've got to find a pharmacy that's open on a Saturday. Then I go wait in line, so it is magic. These acute services are really magic. And of course some chronic management too, but that's a whole different, ball game. But these acute services, I think, are really helpful for patients.
Yeah, we've heard some special stories where in some communities, the pharmacies are coordinating so closely with the emergency departments that when folks go into the emergency departments with respiratory situations, the emergency department will say, I could treat you here, but we've got a 3 or 4 hour wait. I suggest you just go to the pharmacy.
That's amazing.
And it's not even because we're not open. It's like, you're just going to get faster care, and they can totally take care of you over there.
That's amazing.
Like, that's kind of, you're in an advanced state when you're there, but like, that's the reality that can be, right? And I think that shows the value of everyone being able to focus on practicing at the top of their license.
and the network of like that we're all in this for the better healthcare of the patient, right? Not
Yeah.
so that's amazing.
So one last question for me. As you think about, we're trying to push this federal legislation forward, is there anything that you've learned on the state level that individual citizens or pharmacy owners or pharmacy advocates could do to help, push the legislation along or increase the chance that it gets done sooner?
Well, just on a basic advocacy level, right? Like just do it. Like call your legislator, write the letter, use a form letter. It doesn't matter. The sheer volume that they hear from you will raise this level up. I am encouraged at how bipartisan it is.
Yeah.
But again, sharing those stories, talking to our legislators, I'm very encouraged that the conversation even at the national level seems to be, positive around what pharmacists do. I think, making sure it doesn't turn into a turf battle. That's very important. We got to stay on message with that, like that this is just about, keeping pharmacy doors open and keeping access to care. But yes, just everyone should not feel intimidated to reach out to their local, office of their Congress representatives and do their little part. So we
Yeah.
try to help that through state associations and national associations too, to, make that easier. But it's kind of crunch time. I know there's been some movement. We had someone testify in one of the committees in Congress yesterday. It seemed to go extremely well. It doesn't seem like anyone in Congress is not appreciative and understanding of the role we have. So I think it's just going to come down to the politics, but we all can do our little part in that.
Yeah, that's great. Well, Emily, any last thoughts you have for me or the audience before we wrap it up?
No, but just to kind of expand on that just a tiny bit more, legislators do love to hear from people. And so you ask about how it worked on the state level, like, I can go in and testify all I want, and people high up in other associations can testify. But when you as a pharmacist come in and they meet you and they hear your story and they hear how you take care of patients, that really, really matters. So that actually was huge in getting our bills passed here. So again, just don't be intimidated, and they really do want to hear from you. So but thank you for this opportunity, because I think we're, ECAPS is what, 3 years in, and I know it keeps getting close. And so we're just really hopeful we can get this across the finish line this year.
Well, that is some great advice. I love your stories. Thank you so much for joining. I'm here in Madison, Wisconsin. You're talking about being out in Denver. We're recording this right at the beginning of winter time, so I always think to the magical place you are. Snow in the mountains for me and my family is just a very special thing. So next time we get out there, I will be sure to let you know and hopefully get together and see you again in person.
That'd be amazing.
Again. Yeah. Thanks again for joining. It was great to have you today, and join us again on our next episode of the ECAPS Watch podcast.
Sounds great, Kevin. Thanks so much.
Thanks.